I'm currently a physical therapist with ProAxis Therapy, a very progressive outpatient physical therapy company in the country. And we have a very strong mindset to be innovative, use evidence-based mentality with our treatment plans, our treatment approaches and modalities and so forth. And we see Speedflex as a integral part of that, not only from during a treatment plan, but on a post-continuum part as well, kind of a baton pass to for that next step for the patients to progress after they graduate from our treatments. Some of the features about Speedflex that I like as a physical therapist are the fact that the equipment, it provides feedback. So first of all, a patient approaching any sort of new technology can be intimidating. You want to let the patient know that this is safe, which it is. We can easily message the fact that this is accommodating resistance. We have control over which planes of motion and movement they're in, whether it be frontal, sagittal, coronal plane, whatever. We know what we're getting from that equipment. There's not a ton of variability which can predispose them to an injury if they're not doing it right, which is great. And then the other part, it's just innovative. It's nothing that I've seen in the past decade that reminds me of, oh yeah, been there, done that. It does have an isokinetic component to it, but the great thing about the minds behind Speedflex, I think they're utilizing a key component that we've been using for 30 plus years, isokinetics, but they're putting it into a functional pattern. We're doing closed chain stuff with isokinetics, which along the Gray Cook mentality and where everything's moving nowadays with functional movement screens and so forth, physical therapists love closed chain. That's our thing. Open chain with other vendors of isokinetics and so forth, you can't do that. So they're really combining two great things into one and getting ultimately a great physical therapy product as a result.